The rural track resident will basically have the best of both worlds because they will have the majority of their training here in Iowa City in a program that has demonstrated over many years to be a quality program. What they will do is have a little bit more exposure to community-based practice of obstetrics and gynecology in some of our communities that for the most part are in eastern Iowa. The plan is for them to rotate in the first year and do a community-based emergency department rotation. And then in their third and fourth year, they will have 4 elective blocks that will be devoted to community-based obstetrics and gynecology at different affiliated community hospitals that we have agreements with.
The purpose of the Rural Track program is to specifically train residents in rural OBGYN care. That person will actually get a taste for what it's like to practice in OBGYN in a rural setting, and then hopefully will want to further their career in a rural setting. Burlington is a unique city for the Rural Track program because we are located in a rural area. However, we're not too far away from a tertiary care center where you still have that closeness to your colleagues when you have an emergency or you have a question or you need to transfer someone. We as a group practice as a team, so major surgeries are usually done with at least 2 people. So any resident who comes here is going to have access to providers who love to teach as well as practice.
Most of my time working with the physicians either in the operating room or a little bit in the office. For example, their ultrasonographer was teaching me a lot of ultrasounds too. I think what I like about that experience is that it helped me see what it would be like to be in a private practice or be in a community.
Sort of partial to Dubuque. I would like to say that when I trained, I think the whole residency was a rural track program because most of the residents that trained at Iowa tended to stay in Iowa. Now that's not the case, and I think the rural track is to try to give residents experience working in smaller locations around the state.
Dubuque was an opportunity to work in more of a community setting. I got to work closely with a handful of providers that had an excellent mix of OR, OB time, as well as clinic time. I think it was just a very interesting way to just see a different model of practice in a smaller setting.
Over the years, our specialty, like many other specialties, has become gradually more and more oriented toward subspecialty practice or academic practice, and that's sort of the way things have gone with residency programs that are as highly competitive as ours is. By dedicating that one slot toward the rural track each year, we will have the opportunity to have our great training for someone who specifically is interested in rural practice and ideally someone who will stay in Iowa.